I would like to welcome you to the fourth public comment session organized by the National Academies as part of the review of the WIC food package. My name is Kathleen Rasmussen, and I'm the chair of the committee, and I'm pleased to welcome you here today. The task being undertaken by the committee for the National Academies is to review and assess the nutritional status and food nutritional needs of the WIC-eligible population, to provide specific scientifically based recommendations grounded in the most recently available science. Our recommendations must ensure that the WIC packages are consistent with or aligned, I believe is the exact word, with the 2015 dietary guidelines for Americans. They should also address the health and cultural needs of WIC participants and operate efficiently and effectively across the geographic scope of the program. As noted yesterday, we will have one final comment session on June 29th in Washington, D.C., and that meeting will be posted on the website shortly after the end of this meeting. For this session, I will read the names of those registered for a comment sequentially. If a person is not here, we will skip the name and come back to them at the end. Of course, the person who's not here didn't hear me say that, but that's okay. You will be permitted to you will be asked to come to the podium. You will have 3 minutes to speak, and just to help you stay on time, this timer here is preset for 3 minutes. It will turn from green to yellow at 30 seconds and red when the time is up. Now, I don't know. Maybe it's not on yet, because all three of these seem lit up to me at the moment, so I hope this will be fixed by whoever running this. We begin this morning with Janet Charles. Janet is here, yes, who is chair of the board of directors of the National WIC Association. Good morning.
Good morning, Dr. Rasmussen, distinguished members of the committee. I am Janet Jackson Charles, chair of the board of directors of the National WIC Association, the educational arm and advocacy voice of the over 8 million low-income, at-risk mothers and young children participating in the WIC program, and the 12,200 state and local service provider agencies who are in the front lines of WIC services. NWA has previously testified and presented written comments for your consideration, and several of our members participated in yesterday's important panels. I'd like to place our collective efforts in context. We know that families turning to WIC for nutrition assistance are vulnerable, and economic and personal, family, and environmental crises compound their vulnerability. WIC has improved birth outcomes and at-risk children's health, growth, and development, preventing health problems for 42 years. We are convinced that WIC children enter school more ready to learn, showing better cognitive performance. We are proud that, as the nation's premier preventive health nutrition program, WIC is a cost-effective, sound investment ensuring the health of our children. Our convictions regarding WIC successes are based in science, and we are grateful for the role that the Institute of Medicine's Food and Nutrition Board plays in helping to assure a scientific foundation for the foods in the WIC food package. You're well aware that quality nutrition services are the centerpiece of WIC, nutrition and breastfeeding education. Nutritious foods and improved health care access for low and moderate income women and children with or at risk of developing nutrition-related health problems, including overweight, obesity, and type 2 diabetes. WIC has come a long way since it was started as a pilot program in 1972 and became national in 1974. When the program was when the program was funded at $20.6 million. By way of contrast, in fiscal year 2016, we were funded at over $6.35 billion. NWA promoted changes to the WIC food packages better than a decade and a half ago, publishing 2 position papers calling for extensive changes in 2000 and 2003. These position papers became fundamental documents for the Institute of Medicine's 2005 recommendations to FNS to transform the WIC food packages. NWA enthusiastically supported FNS's 2007 interim final rule revising the WIC food packages, and state WIC agencies successfully implemented these changes in 2009. The response from participants, state and local WIC agencies, vendors, and other stakeholders since then has been overwhelmingly positive. NWA was the chief proponent advocating for the IOM's rule in 2005 and current review, and recommended and actively advocated for legislative language enacted in the 2010 Healthy Hunger-Free Kids Act, requiring review of the food packages at least every 10 years. NWA is confident, pardon me, that the changes to the food package, coupled with nutrition education and enhanced breastfeeding counseling and support, are contributing to the health of mothers and young children. And we look forward to your recommendations for a yet improved WIC food package, and thank you for your efforts to further advance WIC for the WIC families nationwide. Thank you.
Are there any questions? If not, our next presenter is Carrie Fry, Vice President of Regulatory and Scientific Affairs for the National Dairy Foods Association.
Good morning. I greatly appreciated the opportunity to participate yesterday in the panel on vendor and manufacturer's perspective. The nearly 200 manufacturers and farmer-owned co-ops that I represent are proud to provide the nutritious milk, cheese, and yogurt products that are part of WIC Foods. Milk is an integral part of the WIC food package. However, we believe that changes to limit the options for children of age 2 years and older and women to only 1% low-fat milk has led to lower redemption and less milk consumption. As I explained yesterday, IDFA recommends that WIC participants should have the flexibility to choose reduced fat 2% milk as long as they're within the 2015 dietary guideline limits for daily saturated fat. I'd also like to talk about other dairy products that make up the WIC food package. Yogurt is naturally nutrient-rich, is low in lactose as a result of the culturing process, and is also a culturally appropriate food option for many families. To encourage WIC participants to increase dairy consumption, the program should allow yogurt in container sizes and flavors that the participants can easily find in the grocery store. The majority of yogurt is sold in single cups that are 6 ounces. The wider variety of flavors and calorie count is available in this 6-ounce container size. And IDFA urges the committee to encourage flexibility in container sizes by changing the requirement to allow 1 quart of milk to be swapped for up to 32 ounces of yogurt. This would allow participants to choose different sizes of yogurt as long as the total was 32 ounces or less. Cheese is also a good source of protein, calcium, and phosphorus. A nutritious, healthy snack. Cheese is naturally low in lactose, and many cheese types, cheddar, Swiss, Monterey Jack, mozzarella, and string cheese, have 0 grams of sugar or lactose per serving. WIC should allow milk to be swapped for a variety of cheeses. It's a versatile food that can be used either on its own as a snack or part of a main entree, even for breakfast, lunch, or dinner. IDFA believes the flexibility in dairy products and continued nutrition education is important to encourage WIC participants to get their full nutritional benefits. We will be submitting more detailed comments for the committee's consideration as well. Thank you.
Any questions from the committee? If not, our next speaker is Nicholas Pyle, who is president of Pilon Associates.
Good morning. Since 1985, I've represented many food companies to WIC programs. Today, I'm here as president of Pilon Associates and not our clients. My written comments detail food safety concerns about fresh produce, raw fruits and vegetables, which are the leading cause of foodborne illness in the United States. FDA recently ended its investigation of Salmonella pula in cucumbers that resulted in 900 illnesses, over 900, in 40 states, resulting in 6 deaths. So the message here is not just about price and shelf life, but also parity of frozen and canned is the message on fresh fruits and vegetables. Yesterday we learned that children are way ahead in fruit consumption, and that's thanks to juice. We also learned that At the age of 12 months, fruit and vegetable consumption drops off a cliff, and that's as the jarred purees from WIC ends in the food package. Swapping fruits and vegetables for 100% juice, which provides the equivalent of a daily serving of fruit for the entire month, and jarred infant purees in the WIC prescription would leave participants for days, if not weeks, without any fruit or vegetable benefit. Increasing the CV doesn't help alleviate the fruit and vegetable gap, it exacerbates it. Changing gears here, whole grains, WIC should consider the addition of bagels, pitas, flatbreads, also ancient grains. We heard a list of those yesterday, but those offer a variety of gluten-free alternatives. On milk, IOM should consider a return to 2 pounds of cheese as a swap for milk. Also, yogurt should be allowed as a swap for milk, quart for quart, and that a participant be allowed a choice of variety, whole fat or low fat. Presently, WIC only allows soy-based plant milks. Expanding this to include fortified almond, coconut, cashew, rice, and other plants would provide numerous additional vegan resources of proteins. We talked a lot yesterday about up-to sizing. USDA guidance is all over the place on up-to sizing. You're allowed up to 16 ounces for brown rice, but you're not allowed up to 16 ounces for whole grain pasta. You're allowed up to 64 ounce in refrigerated cartons for citrus juice, but not for fruit juice. Allow states the flexibility to broaden consumer choices with up-to sizing for all food packages. Please understand that WIC is very important to food companies. For marketing, it's responsible for the try. To sales, WIC authorization means statewide product distribution, reduced slotting fees, valuable retail shelf space, and opportunities for line extensions. That's why the food companies are here today. Our work for CPGs targets 2 objectives: to increase approvals and raise awareness of product eligibility. I learned a lot yesterday, and I thank you for the opportunity to be here today.
Thank you very much. Are there any questions from the committee? I have one question for you, sir. You said that increasing the cash value voucher exacerbates the fruit and vegetable gap. Could you explain once more what you mean by that, please?
With juice, you get 4 ounces a day for the entire month. With jar purees, you get 32 jars, which is enough for 1 jar for the entire month. 1 jar per day. You can trade that for 2 or 3 days worth of potatoes.
Okay, I get it now. I get it now. Thank you very much. You're talking about different ages, though. All right, our next speaker is Diane Welland, Nutrition Communications Manager for the Juice Products Association. Is Diane Welland here? Yes, she is.
Thank you for this opportunity to deliver these oral comments. I'm a registered dietitian working with the Juice Products Association, and the association represents processors, growers, packers, and suppliers to the juice industry. And I want to commend the committee's efforts to update the WIC food package based on current science and government guidelines. JPA supports current recommendations that 100% juice is part of a healthy diet for children and pregnant, breastfeeding, and postpartum women, and should continue to be included in the WIC food package to ensure that these groups meet daily fruit consumption goals. And here are 3 evidence-based reasons why 100% juice is nutritionally important to the WIC participants. First, 100% fruit juice is a nutrient-dense, healthful beverage that delivers significant nutrients in the diets of women and children. This is supported by the 2015-2020 dietary guidelines, which include 100% juice as one of the primary beverages to be consumed by children and adults due to the beneficial nutrients it provides. The guidelines specifically recognize that fruit and vegetable juices, along with milk, deliver important nutrients such as calcium, potassium, and vitamin D. Furthermore, the USDA nutrient data and recent 2015 research shows that 100% juices on a gram-for-gram basis contribute the same nutrients as whole fruit. For this reason, the 2015-2020 dietary guidelines continues to include juice in the fruit category, as should the WIC food packages. Second, 100% juice plays an important role in helping women and children meet recommended daily servings of fruit. Eliminating juice from this package could result in unintended consequences. Our recent NHANES modeling data, which removed 100% juice from the diet and replaced it with water, found that total fruit intake by WIC participants, and this was both adults and children, was reduced by more than 40%. With such a large gap, it's unlikely that these numbers can be made up by eating whole fruit alone. This change negatively impacted healthy eating index scores and intakes of key nutrients such as potassium, particularly in children, further reinforcing the point that reducing or removing 100% juice from the current WIC package could negatively impact fruit consumption and expanded nutrient deficits. Third, 100% fruit juice is not overconsumed by young children. USDA data shows that compared to older children, children ages 1 to 3 get a higher percentage of their fruit intake from fruit juice, yet averages still fall within the parameters set by the American Academy of Pediatrics, which is 4 to 6 ounces daily. The Dietary Guidelines Advisory Committee found the young children consume more whole fruit than 100% fruit juice and come closest to recommended intake patterns. And as we saw yesterday from the presentations, the youngest group of children is the only group that actually meets the Dietary Guidelines recommendations for fruit, and much of that is credited to juice. In conclusion, JPA asked the committee to consider 3 things: rely on evidence-based science, follow the new dietary guidelines policy recommendations, and consider 100% juice as a way WIC families can include an affordable, accessible, and nutritious form of fruit in their diet. Thank you.
Any questions from the committee? Yes. Helen. Yeah, use the mic, please.
I'm Helen Jensen. Thank you for the comments. You mentioned that eliminating juice and substituting water with the expectation of whole fruit would reduce the total fruit consumption. And I was wondering if you had any evidence of that.
So we do have a study that did, as mentioned, there's modeling data. Modeling data where we did take out the juice, with it, and replace it with water. So yes, and I'll be submitting that with the written comments.
Okay, thank you.
Okay, thank you very much. Our next speaker is Solene Kintz, Director of Public Affairs for the Dannon Company.
Hi, good morning. My name is Solene Kintz, and I'm the Director of Public Affairs at the Dannon Company. On behalf of Dannon, we thank you for the opportunity to provide comments regarding the National Academy's review of the WIC food packages. Guidance that encourages Okay. However, as you heard yesterday, smaller single-serve yogurt containers are the consumers' preferred options, and their convenience and variety would help meet the needs of WIC participants and support intake of this nutrient-dense food. Single-serve yogurts may also help with portion control and with limiting caloric intake. Second, we recommend that the National Academies provide guidance that encourages states to include yogurt containing low-calorie sweeteners. While not excluded by USDA, yogurts with low-calorie sweeteners are generally not selected as offerings in the WIC package. Plain yogurt is naturally tart, and low-calorie sweeteners are used to make yogurt more palatable while maintaining nutrient density. Women in the WIC program tend to consume too much added sugar, and many are overweight or obese. Yogurts with low-calorie sweeteners offer flavor and style variety and are common choices among young women. Therefore, they can help WIC participants increase their consumption of nutrient-dense and under-consumed dairy foods while helping them reduce sugar intake. Third, the National Academies should recommend reducing the amount of total sugar allowed in yogurt from 40 to 30 grams of total sugar per 8 ounce. Danone and others in the yogurt industry have already made significant reduction in sugar content. In fact, 80% of the flavored yogurts sold today contain 30 grams or less of total sugar per 8 ounce. Providing guidance for yogurt with 30 grams or less of total sugar has the potential to support positive health outcomes and will be consistent with current dietary guidance to limit intake of added sugar. In summary, recommending single-serve sizes of yogurt will allow WIC participants access to yogurt in more convenient sizes. Additionally, recommending reducing total sugar allowed in yogurt and encouraging inclusion of yogurt with low-calorie sweeteners can help limit intake of added sugar. We hope you will consider 3 simple recommendations as you provide guidance for WIC food package revisions. Thank you for the opportunity to provide comments.
And just to decode that, a low-calorie sweetener is an artificial sweetener? Okay, thank you. Other questions from the committee? If not, thank you very much. Our next speaker is Casey Lewis, Health and Nutrition Lead for Welchs.
Good morning. As mentioned, my name is Casey Lewis. I'm Welch's Health and Nutrition Lead and Registered Dietitian. As a dietitian, I know firsthand how challenging it can be to help people enjoy healthy diets, and I appreciate the work the committee is doing to support WIC participants in doing so. As you know, most Americans, including WIC participants, don't eat enough fruit every day. The 2015 to 2020 dietary guidelines acknowledge this and recommend that all forms of fruit, including 100% juice, can add up to help people meet daily fruit needs and build healthy dietary patterns. Research shows that as a complement to whole fruit, 100% juice plays an important role in the WIC package to help families get the nutrition benefits of fruit. 100% juice consumption helps families, including WIC participants, get closer to meeting daily fruit recommendations. And when people do this, they're also drinking juice in moderation. They're also still getting 2/3 of their fruit from whole fruit, as the 2015 dietary guidelines note. Drinking 100% fruit juice improves overall diet quality and nutrient intake, including vitamin C and potassium, which the committee noted as key nutrients of concern. Limiting access to 100% fruit juice could further widen families' existing fruit intake gap and lead to other unintended consequences. That includes increased likelihood that people will consume less nutritious beverages. Among WIC participants, consuming 100% juice is associated with a reduced likelihood of consuming sugar-sweetened beverages. And in a recent survey, families in food assistance households told us that without access to 100% juice, they would consume more sugar-sweetened, less nutritious beverages like fruit drinks, sodas, energy drinks, and sports beverages. Finally, despite common misconceptions when consumed in moderation, 100% juice is not associated with excessive energy intake, obesity or overweight, dental caries, or low fiber intake, which was acknowledged by both the 2015 Dietary Guidelines Advisory Committee and this committee in its interim report. 100% fruit juice contains no added sugar, adds variety to the diet, and provides the nutrition of whole fruit in an affordable and accessible form. The 2015 dietary guidelines note this, stating that 100% juice is a nutrient-dense beverage that should be consumed as a primary beverage choice alongside water and milk. I encourage this committee to extend the science-based recommendations of the 2015 dietary guidelines and continue to include 100% juice in the WIC package to give families the options they need. Thank you.
Are there any questions for our speaker? If not, thank you very much. Our next speaker is Jeff Boutelle, President and CEO of Beechnut Nutrition.
Thank you. Good morning. I'm Jeff Boutelle. I'm the CEO of Beechnut Nutrition Company, a small mission-based company whose nutrition and education objectives are very closely aligned with those of the WIC program. I'm here today to share some data supporting the need to maintain the current baby food package options for WIC. If the number of baby food jars is reduced, it's highly likely that the consumption of fruits and vegetables will also be reduced, leading to a decline in vitamin and mineral intake in WIC infants, increasing nutritional risk. Moms will not fill the void by making nutritious homemade baby food. If there's a desire for more fruits and vegetables in the WIC food package, it shouldn't come at the expense of convenient baby food jars that do provide high-quality fruits and vegetables and the nutritional and taste variety value that comes with them. Two key reasons. First, parents need added convenience. Not all parents have the time, desire, or ability to make their own baby food. In fact, most don't. Our research shows, a big quantitative study across the country, thousands of moms, that 40% of moms never make their own baby food and 54% of moms make homemade baby food less than once a month. And that's all moms, general population. Further, qualitative research shows that WIC moms actually do less homemade than non-WIC moms. While not all WIC moms have been redeeming all of their baby food jar vouchers, it's important to note that many also don't like their choices. They tell us, I get the runny, watery stuff. That's what they give me. There is now a better option with our new Naturals line. We, unlike our large competitors, actually use fresh fruits and vegetables when we make our baby food. They're minimally processed with nothing added, no added water, no sugars, no starches, nothing. If it says just carrots, there's one word on the back of the jar, carrots. And we've taken the steps to make our Naturals line available to WIC moms in many states. Second, diets that include baby food deliver more balanced nutrition. Based on a new NHANES analysis of babies and toddlers under the age of 2 and a compendium of research on early infant nutrition being presented at Experimental Biology, it's clear that including baby food during the early years is even more critical than we thought. Most infants and toddlers aren't getting nearly enough vegetables, fruits, and whole grains in months 0 through 24. However, during the baby food window of 6 to 8 months, they clearly get a more balanced diet. Baby food is the #1 source of fruits, vegetables, and whole grains until 9 months of age. We believe this is because with jarred purees, it's easier for parents to feed their kids a wide variety of fruits, vegetables, and whole grains. Once they begin to transition away from baby food, we see a decline in these nutrient-rich foods and an increase in added sugars and sodium, with some babies getting at or above adult levels by 12 months. Even with nutritious fresh and frozen and canned fruits and vegetables available, once they transition from baby food, we see a decrease in vegetable consumption and an increase in sugar-sweetened beverages, cookies, brownies, French fries, and potato chips. Potatoes become the leading source of vegetables, and the number of leafy green vegetables becomes nearly non-existent. One last comment. In addition, published research suggests that babies are actually forming taste preferences and eating habits during this time of critical development. So we should be actually encouraging a wide variety of baby foods, not pulling back. Concerns about wanting more texture can be addressed by introducing more stage 2, but mostly stage 3 jars in the WIC package. Thank you. Are there any questions? Thank you.
Thank you very much. Our next speaker is Yvonne Bronner, professor at Morgan State University.
Good morning. My name is Yvonne Bronner, and I'm a professor at Morgan State University School of Community Health and Policy and a nutrition advisor for Dannon's One Yogurt Everyday initiative. Of all the transitions the WIC program has experienced since it was established in 1974, no change has been more meaningful to the health of participants in the program than the change in the WIC food package. Alignment of the food package with current dietary guidance is essential in WIC because it serves the most at-risk segment of the population for nutrition adequacy, chronic disease, and health disparities during the critical periods of the life cycle: pregnancy, lactation, infancy, and early childhood. In 2006, the most dramatic change in the history of the WIC program occurred. The final and one of the most important implementation of those changes was the recent addition of yogurt to the WIC food package, because yogurt provides 3 of the 4 nutrients of public health concern identified by both the 2010 and 2015 dietary guidelines: calcium, potassium, and vitamin D. Yogurt also pairs well with fresh fruits, vegetables, and whole grains, thus potentially shifting the pattern of food intake for WIC participants in a more healthy direction. Additionally, yogurt's high-quality protein content may help increase protein intake for pregnant women who consume less than the AMDR for protein according to the 2015 DGAs. Yogurt can even add value by pairing with other high-protein rich foods in the WIC package. Diagnosed or perceived lactose intolerance is common in the WIC target population, limiting consumption of dairy in the diet that may impact long-term bone health. Both IOM and USDA recognize yogurt as a more easily digestible dairy source because yogurt's live and active cultures help break down lactose in milk, allowing many to eat yogurt without experiencing lactose intolerance symptoms. Therefore, real or perceived lactose intolerance maldigestion need to be addressed as WIC's demographic shifts toward more diversity. And then finally, WIC rightly examines their clients' experience of the program as an important factor for sustained enrollment and participation. And therefore, we strongly recommend that the size and the diversity of quantity of yogurt be considered. These WIC food package revisions can help WIC participants have access to 1 yogurt every day to improve their diet quality, their WIC experience, while supporting healthier eating patterns. Thank you for the opportunity to provide comments.
Are there any questions from the committee? If not, if not. Our next speaker is Lorelei DeSogra, who's the Vice President for Nutrition and Health at the United Fresh Produce Association.
Good morning, everybody. I'm Lorelei DeSogra. I'm the Vice President for Nutrition at United Fresh Produce Association in Washington, D.C. Thanks for the opportunity to provide comments this morning. 10 years ago, United Fresh had the honor to collaborate with the National WIC Association and also many of my colleagues in this room from the California WIC Association to ensure that the IOM's 2005 recommendations actually resulted in policy change. Today, more than 8.2 million WIC moms and children benefit from having the fruit and vegetable cash value voucher, which has improved the healthfulness of the WIC food package, aligned WIC with the dietary guidelines, increased fruit and vegetable consumption, and improved public health. And I just want to comment from yesterday, I think first and foremost, WIC is the premier public health nutrition program in this country, and many of us don't want to see it turn into SNAP, just as an aside. I think many of you join me in that comment. So we want to keep it the premier public health nutrition program. So even though the CVV has increased fruit and vegetable consumption, which is great, we all know the CVV is limited. And as the IOM's interim report states, fruit and vegetable consumption for the WIC subpopulations is still inadequate to meet needs and inadequate to meet the dietary guidelines. So we make the following recommendations. We've got longer comments in our written report. For breastfeeding, and let me just say that many of these recommendations we've worked with the National WIC Association on. For breastfeeding moms, increase the value of the fruit and vegetable CVV to at least $12 a month. Be great if it could be more. To improve support for breastfeeding and to really try to incentivize that package. For infants 9 to 11 months, allow states the option to replace all jarred infant fruit and vegetables with a fruit and vegetable CVV, if that's what the moms want. For mothers and children, allow states the option to fully replace the juice benefit with CVV. I think all of you know what the American Academy of Pediatrics recommends, so we won't go into it. For children, increase the we're all very concerned that kids drop out of WIC, especially since we have this gap between when they drop out and when they go to school, and have now healthier school meals, thanks again to the IOM and your recommendations and the work done by USDA. So for children, I would really like to recommend that the voucher for fruits and vegetables be increased, and obviously we need more research to figure out how do we keep WIC children in WIC. One other point that I do want to make is around the country right now, there are fruit and vegetable incentive programs going on all over the place that benefit SNAP families, but right now they're not benefiting WIC participants. So we would really like to see those kinds of programs expanded to reach WIC. Thank you for this opportunity, and we'll be submitting detailed comments. Thanks.
Any questions from the committee? If not, our next speaker is Mindy Josephidis, WIC Director from the Intertribal Council of Arizona, and I apologize if I did not pronounce your name correctly.
Good morning, committee members. Thank you for the opportunity to present comments regarding the important work that you're doing to review and update the WIC food package. My name is Mindy Josephidis, and I'm a registered dietitian and the WIC director for the Intertribal Council of Arizona. ITC is a WIC state agency, and we provide services to 11 reservation communities in Arizona and 1 urban Indian health agency. We were very pleased to see the previous review of the food package and the changes that came out of that more closely aligned with dietary guidelines, AAP recommendations, and the education that we were providing to clients. While the changes improve the food package, there are opportunities for further improvement to provide foods that are culturally acceptable, easy to purchase at the store, better able to meet nutritional and developmental needs of clients, and to support breastfeeding. I'm going to talk about primarily the cultural part, and my colleague, when she goes, will talk about some of the other things. American Indians in Arizona traditionally gathered or farmed foods such as squash, beans, corn, cactus, and many native plants. Traditional foods are usually not sold in stores, and that makes it difficult to add to the WIC food package. They also have limited availability because they're usually naturally harvested. But there are some ways that we can incorporate healthy traditional practices into the WIC food package. This is probably something you haven't heard yet. ITCA recommends that IOM consider the addition of blue cornmeal as a whole grain in the WIC food package. Blue cornmeal is a whole grain that's made from blue corn, or Hopi maize they call it, and it is available commercially. Blue cornmeal is an essential part of Hopi dishes and also is really important to Hopi culture. It's also prominent in Navajo cooking and culture as well. It has more protein and a lower glycemic index than yellow or white corn, and it's traditionally used to make things like blue corn mush, piki bread, and dumplings, and a lot of people nowadays use it to make things like pancakes or tortillas and other grain products. ITCA also recommends that baby foods provided by WIC more closely align with traditional feeding practices. Infant cereals and meats are not commonly used among the American Indian population, although introduction of the jarred baby food has increased the utilization. It's still very underutilized. Our clients generally feed home-prepared traditional foods like beans, squash, and potatoes. And as I said, checks for those foods, for the jarred foods, are generally under-redeemed. So allowing clients the option to purchase other foods like beans and fresh fruits and vegetables in place of the baby cereal, baby meats, and jarred infant foods will better accommodate traditional feeding practices. ITC also recommends that infants aged 9 to 11 months be provided with a food package that supports their developmental needs, such as self-feeding. As babies reach 9 and 10 months of age, they are increasingly eating age-appropriate finger foods rather than baby foods, and WIC should support this transition by providing fresh fruits and veggies, breakfast cereals, beans, and tofu. Thank you for allowing me to provide comments.
Comments from the committee? Questions? Okay. Our next speaker is Karen Farley, Executive Director of the California WIC Association.
Good morning, committee, and thank you for your noble service to review the food package, the informative meeting yesterday, and the opportunity to comment. In June 2015, the California WIC Association and local WIC staff provided extensive comments on the food package, and those are on record, and we stand behind those comments. We also support the comments, the extensive comments submitted by the National WIC Association. So we'll comment on some other things today. First of all, we'd like to just embrace this opportunity in history. Never before have we had such a focus in our healthcare on prevention. This is our time. We've been waiting for this our whole career. So please stay true to that focus on prevention and chronic disease as you make your decisions. And it appears that WIC families have voted with their time and their money on several foods, and some hard decisions probably need to be made to let go of some foods, reduce some foods, and using our biggest food supply in the world to select some other foods that will impact population health. If people aren't eating the food, we're not impacting population health. So we ask you to do the best you can to make those decisions. They're hard decisions, but we have such a diverse food supply here. We've heard repeatedly, and we submitted in our comments, we do support really supplementing family food budgets with fruits and vegetables. And another idea might be the provision of whole, lean protein in other sources, whether it's legumes or even meats, various meat supply, sources of meat. Every ounce and every calorie that is supplied not only impacts that family food budget, which we heard a lot about yesterday from different angles, but it also impacts chronic disease. So those food dollars have a much bigger value than what is just going into that family's household. It's impacting and reducing chronic disease, and those are very valuable ounces of food and dollars. Moving on from the unredeemed foods is the introduction of solids. We would encourage you to look again at the science behind oral development, and are we really introducing solids in the way that taps into how babies are developing? We heard some reference yesterday from Dr. Johnson about key time points when children or infants are very curious about soft and lumpy food. And we hear about the unredeemed infant and pureed foods. We appreciate the support of the food manufacturers, but I think we collectively need to look at oral development and our kids being provided the appropriate foods for their development and that family food table and providing families with foods that around the world children are introduced to foods in different ways than they are here in the U.S. And then lastly, we would ask you to look at functional ingredients. Years ago, formula manufacturers began adding DHA and ARA into formula, and WIC has been forced to purchase formula that hasn't been proven, as far as we know, to impact population health. And we've had to spend millions of dollars on those formulas. And is there another way to provide formula to our population of normally healthy term babies and save those food cost dollars for other foods in the family food budget? Thank you.
Questions from the committee? Our next speaker is David Myers, partner in Touchstone Growth Partners.
Hey, good morning. My firm provides consulting services to manufacturers of breakfast cereals, soy beverages, dried fruits, whole grains, and juice. I'd like to thank you for the opportunity to present comments on behalf of Harvest Hill Beverage Company, maker of Juicy Juice 100% juices. Harvest Hill Beverage Company recommends that 100% juice continue to be included in the WIC food package as part of a healthy diet for women and children to ensure that they continue to meet daily fruit consumption goals. Juicy Juice has supported the WIC program for over 25 years. We firmly believe in whole fruit consumption and actively promote it. We are committed to maintaining the quality of our 100% juices made with 120% vitamin C, no added sugars or artificial ingredients, while responding to the diverse cultural tastes of our consumers. We believe that, number one, 100% juice should remain in the WIC food package. 100% juice delivers significant nutrients in the diets of women and children. Juice consumption continues to be supported by the 2015 dietary guidelines in accordance with the parameters set by the American Academy of Pediatrics, depending on age, 4 to 6 ounces per day. 100% juice plays an important role in a healthy diet. A recent study evaluated the impact of removing juice from the food package. Results indicate that 100% juice consumption correlates to consumption of other healthy choices, such as milk and whole fruit. When these items are combined, the results suggest better nutritional outcomes overall with juice than without it. Finally, there's a need for evidence-based research supporting better outcomes resulting from the reduction or the elimination of 100% juice. Evidence-based research is needed to support claims that participants will replace juice with whole fruit, change their behavior, and maintain the nutritional integrity of the WIC food package. For example, will participants consume enough whole fruit to compensate for the reduced vitamin C intake? In conclusion, and thank you again for giving us this opportunity to comment, we respectfully ask the committee to consider 3 things. Continue to follow the 2015 Dietary Guideline Policy recommendations supporting inclusion of 100% juice. Remember that 100% juice is an important way for WIC families to continue to include an affordable, accessible, and nutritious form of fruit. And finally, rely on evidence-based research to support recommendations as it relates to juice in the WIC food package. Thank you.
Questions from the committee? If not, thank you very much. Our next speaker is Ken Prokash, Sales Manager from Apple and Eve, LLC.
Good morning. Apple and Eve is a manufacturer of 100% fruit juices under the Apple and Eve, Northland, Seneca, Sesame Street, and Tree Sweet brands, and been in business for over 40 years and a partner and participant in the WIC program for most of those. I would like to take this time to remind the committee that the 2015 Dietary Guidelines for Americans report includes 100% juice as part of the fruit food group and recommends 2 cups equivalent of fruit per day for an individual consuming a total of 2,000 calories daily. 1 cup of 100% fruit juice counts as 1 cup of fruit, and the report suggests that up to half of the daily fruit intake comes from 100% juice, which does not contain added sugars. The report also notes that 3/4 of Americans do not consume the recommended amounts of fruits and vegetables. The dietary guidelines also, and the American Academy of Pediatrics concur that 4 to 6 ounces of 100% fruit juice per day is appropriate for young children. And for children 7 and older, the serving sizes to increase to 8 to 12 ounces per day. Please remember, there are no added sugars in 100% fruit juice, and just the natural sugars found in the whole fruit. And 100% fruit juice is a simple way to include more fruit in a diet. Research published in the International Journal of Child Health and Nutrition, Public Health Nutrition, American Journal of Health Promotion, and the Archives of Pediatric Adolescent Medicine analyzed data on diet quality of juice drinkers. Their findings showed juice drinkers generally had higher levels of important vitamins and nutrients, including vitamin C and B6, folate, potassium, magnesium, and iron. This is particularly important for potassium, which was signaled out as a nutrient of concern by the 2010 dietary guidelines due to low intakes. Consumption of juice also associated with lower intakes of total fat, saturated fatty acids, discretionary fat, and added sugars with higher intakes of whole fruit. Total fiber intake among juice drinkers was either the same or higher than non-juice drinkers. Compared to non-juice drinkers, drinking 100% fruit juice is not associated with weight gain in children or adolescents. 100% juice drinkers showed better nutrient intake, nutrient adequacy, and diet quality than non-consumers, and indicating that 100% fruit juice is a healthful nutrition-dense beverage. Yesterday, we provided information confirming that the average fruit intake among children falls within the recommendations of healthy eating patterns and dietary guidelines, but adult women are falling short of recommended intakes. 100% fruit juice is definitely a contributing factor to the children meeting this goal. Apple and Eve concurs that the addition of fresh fruits and vegetables also has a positive impact on the WIC program, but fresh fruits and vegetables cannot be the sole avenue used for women, children to recommend the daily amounts of fruit for their intake. There needs to be and remain a balanced combination of fresh fruits and 100% fruit juices available for your WIC clients to choose from to maintain and increase these numbers. Finally, Apple and Eve would like to ask the committee to have 100% fruit juice continue to be on the WIC food card at their current levels and at the rates that the dietary guidelines and American Academy of Pediatrics have set and recommended. Thank you.
Thank you. Are there questions from the committee? Our next speaker is Brandi Warwick, WIC Nutrition Manager at the Intertribal Council of Arizona.
Good morning, committee members. Thank you for the opportunity to comment on the WIC food package. Again, my name is Brandi Warwick, and I am a registered dietitian and the WIC Nutrition Manager with the Intertribal Council of Arizona. ITCA supports the addition of yogurt and whole grain bread to the food package. However, the purchasing experience at retailers for these foods can be difficult for clients. ITCA recommends that any fat content of yogurt be allowed for children under 2. USDA requires that yogurt be provided to clients at the appropriate fat level for the age of the child. Children under 2 must receive whole fat milk yogurt, and children over 2 must receive low fat yogurt. Brands and flavors of whole milk yogurt are limited. Plain yogurt is the most commonly available and may not be as acceptable or palatable as flavored yogurts. The majority of milk category is provided as fresh milk, and only 1 container of yogurt may be provided to clients, so the difference in fat intake will be negligible. ITCA recommends the range of containers and package sizes be allowed to accommodate marketplace variations to improve participant access and choice. Current USDA policy requires foods to be provided at the maximum amount of the food package for many of the foods. Due to package sizes, this limits options available to WIC clients and may result in WIC overpaying for foods compared to other customers. For example, in order to receive the full package for juice, women may only purchase frozen containers of juice, and children may only receive the shelf-stable or refrigerated juices. This limits options available for the 2 categories. Women may not purchase vegetable juices that are allowable since they do not come in frozen varieties. Vegetable juices are a better option for many women because they have a lower glycemic index. Frozen juices are difficult for small stores to stock since precious freezer space must be used to store the juice. Frozen juice was identified by WIC staff as the most common item that is not purchased in a non-infant food package. Bread is generally sold in 24-ounce packages. However, WIC allows only 16-ounce packages of whole grains. 16-ounce loaves of bread have limited availability and are made especially for the WIC market. Bread is stocked by outside vendors. Bakeries and stores have limited control over stocking. Bakeries have to pay for unsold stock that goes out of date, so they're reluctant to leave extra stock that may not sell, causing stores to run out. With a limited consumer base, stores can charge more for the 16-ounce loaf than the same 24-ounce size. WIC is paying more money for less nutrition value than other consumers, so it's not cost-effective for the program. ITCA recommends that whole grains be allowed in sizes from up to the 24 ounces. Thank you for the opportunity to provide comments to the WIC food package.
Any questions? Our next speaker is Carolyn Takata, Director of Marketing at Silgan Containers.
Good morning. My name is Carolyn Takata, and I'm the Marketing Director for Silgan Containers. We are the largest food can manufacturers in the United States, but I'm actually here today representing all food can manufacturers. As you already know, very few Americans meet the dietary requirements for fruits and vegetables. But experts agree that eating more fruits and vegetables, whether canned, frozen, fresh, or 100% juice, is an essential part of a healthy diet. Plus, 23.5 million Americans live in food deserts, where they have little or no access to fresh food sources. Americans rely on canned fruits and vegetables as part of their produce intake, and those on food assistance are even more dependent on canned foods to ensure that their children are getting their recommended fruits and vegetables. And in fact, in a national survey, in an average week, Americans consume more than 5 cans of fruits and vegetables. But for those on an assistance food program like SNAP or WIC, their consumption of canned fruits and vegetables is more than 7 in the same week. More than half of the respondents in this survey feel canned fruits and vegetables are extremely or very important in helping them prepare convenient, nutritious, and affordable meals. This number rises to 2/3 for those families on a food assistance program. Canned foods are just more economical. For $10, you can buy 15 portions of fresh fruits and vegetables, but for the same $10, you can purchase 23 portions of canned fruits and vegetables. Furthermore, limiting language that says without added salt or added sugar in nutrition guidance impacts people's perception of the healthfulness of packaged fruits and vegetables, and ultimately limits or reduces their overall consumption of fruits and vegetables. Yet studies concluded by Michigan State University, UC Davis, and Oregon State University have all concluded that canned foods have similar and sometimes better than nutritional profiles than their fresh or frozen counterparts. Plus, an analysis published in Nutrients shows that adults and children who ate more than 6 canned food items over a 2-week period were much more likely to meet or exceed the recommended daily allowance for 17 essential nutrients than those who only consumed 1 to 2 cans for that same 2-week period. So we are strong advocates of the all forms message and believe that the WIC guidelines should mirror the recommendation of the 2015 Dietary Guidelines for Americans and continue to include canned options in their program. Thank you.
Questions? Our next speaker is Samara McGregor, Senior Nutritionist at the PHFE WIC.
Good morning. Thank you for committee members for all your work that you're doing and for allowing us and providing us with the opportunity to speak today. I would like to talk about the food package for infants 6 months and older. I would like to request that we provide the opportunity for our moms to have a CVV, a cash value voucher for fruits and vegetables for the infants instead of baby foods, or they can have the option of doing that. Especially taking into consideration the oral development and the research that was presented yesterday by Dr. Johnson. It really proves that it would be very helpful for our moms, and it would make the food package more appealing, which brings me to my next point. We heard several comments yesterday comparing the WIC food package to SNAP. We in the WIC community appreciate all the work that you're doing to provide a scientific basis for the food package. And we would love to make it even more appealing in terms of the nutrient value of the food package, selection of foods, and the value of foods. When you have a family who has to go through quite a bit of a hassle to apply for WIC, they don't realize how much support they get in terms of nutrition education, breastfeeding support, and referrals, and then they get the voucher that is about $40 worth versus SNAP benefits, which are at about $100, depending on the size of the family. So we need to remember that WIC is a premier public health program. We've heard that. And let's not forget that and maintain the value and such the the power that this program has to the health and well-being of our children. Thank you.
Questions? Our next speaker is Karen Saluja, Executive Director of the PHFE WIC program.
Good morning. I want to thank you so much for coming to Irvine and allowing us this opportunity to speak to you. Kiran Saluja, and I run the largest local agency WIC program in the nation. We serve realistically about 250,000 women, infants, and children every month. I want to talk to you today about CVV. We've all heard everybody's asking you to give more, be creative, add more. Well, how are you going to do it? That's the issue. So there's a couple of things I want to put out. First of all, I want to kind of tie it to breastfeeding and formula, because we've got to save the money somewhere. We've heard that more women are breastfeeding than non-breastfeeding in the WIC program right now. We've heard that WIC breastfeeding rates have really gone up. Dr. Johnson talked to us yesterday that the prenatal and the breastfeeding women provide a very lush, flavorful experience in utero or through breast milk to babies, which then leads to the acceptance of fruits and vegetables, especially vegetables. So in spite of the fact that there was so much consternation around Dr. Gunderson's comments, one of the things he said, which really struck me, is, are you all about breastfeeding or formula feeding? This is so confusing. I think we really need to take a stand, and I wanted to kind of ask this committee to go where no committee has gone before, quote unquote, and really take a stand on what happens in that first month. Let's make it really clear that in the first month, there is no formula for anybody. This wishy-washy thing of one can, no cans, it's extremely confusing. We know that over 95% of our moms go into the hospital wanting to breastfeed. They come to WIC and we dangle the free formula. Let's not do that. Let's make the first month about supporting moms with breastfeeding and support for those who are wavering. And let's use that saving to put back into fresh fruits and vegetables. If somebody needs formula because there's a medical contraindication to breastfeeding, let's treat it like package 3. Let's have a formulary for it. Let's give them that formula because that's what's needed. Now, going beyond that, what about formula in the subsequent months? Why do we give such a full package of formula? We know that 16 ounces of bread is not going to feed the kid for the whole month. We know that a dozen eggs, I mean, these are supplemental. Why is formula the full complement? Let's make it truly supplemental. Let's bring down a can. Will that make a difference? I know there are people in this room who are probably like, oh my God, she's gone rogue. And I will admit, I am going rogue. But I think it's about time we took a stand as a program that we're very clear in our mission. And what we want to do is support breastfeeding. I think we can do this. We need your support to do this. I would like to also suggest that the committee goes all the way to the USDA limit and actually do that extra 10%, because I think you have a leeway with cost neutrality. And from what I'm hearing from USDA, they'd like you to go further. So make a bold recommendation, go push the limit, go beyond what they've told you to do. Billions of dollars are being sent back, millions, in unspent food funds. I don't believe we want Congress to keep appropriating WIC at a lower level because we're not using food funds. Tell them to spend more, put it in CVV. Let's not have more juice. Thank you.
Are there questions from the committee? Okay, our next speaker is Elizabeth Herrera from the Riverside County WIC program.
Good morning. My name is Elizabeth Herrera. I said thank you. I want to thank you first for allowing me to be here these 2 days. I am a health educator in IBCLC at a Riverside County WIC site. I work at an actual site. So today I'm here to share with you a little bit about what goes on there, probably a little bit of the voice of the participants that you're here together for. So I want you to know, first of all, that they truly appreciate everything that is done. They really like WIC. They appreciate the help, the support, everything we do. The supplemental plays a big role, but everything else that we offer to them, the support on breastfeeding, the education. I am part of the education committee as well, and I know how they appreciate that. And, but also more specifically to the food package, there is some concerns out there, and listening and learning a little bit about the cost and everything that goes on a little bit behind the scenes. I would like to share with you the big concern, for example, on milk. You know, when the milk went from whole or 2% into 1% or skim, it's not quite yet accepted yet, you know, by them, because they're not used to that, some of them. I mean, literally, they say it tastes like water. It's not good. And they don't think it has the nutrients that whole milk and 2% will offer, to the point where what they do is they use their own money to go and buy whole milk or 2%. They cash the check because it's combined with milk and other items, and they have to, but they really don't use it. And if they could, they wouldn't. They've come back with it some ways. They give up some of the other foods because they don't like that one. Infant meats, it's another big issue because you know, they claim they don't like it, or it's the texture for the little ones. You know, Dr. Johnson mentioned yesterday, sometimes we assume they don't like it. It could be the texture. But the point is that they don't want it. They ask us, please tailor it. Could you please give me more fruits and vegetables or something different? They don't want, they're like in the middle where they don't want to lose the food, but at the same time, they're not using it. And they'll come back. I mean, literally in their folders, they have, well, here in California, we still have checks. So they come back with the actual checks in the folder for all the meats. It's hardly ever redeemed. Another thing that I've noticed a lot is the request for beans. It has gone up, and one of the reasons is, you know, because when we talk to them, it's there is too much peanut butter. So an alternate to peanut butter will be really good. You know, they like peanut butter, and they do take it. But again, their words sometimes is, there's only so much peanut butter I can have, or the allergies, or the school, or I don't have no more room in my pantry. I mean, I'm sorry, that is true. This is like them. So an alternate to it, you know, will be good. Don't take it away because they do use it, but it's just something different that will provide the same amount of nutrients. Juice, they like juice. You know, we know in the education part of it, they like it. However, they make it very clear that they would rather have fruits and vegetables to have a choice and make their own. You know, the popular green juice, the only way they have access to it is with their own fruits and vegetables. So an increase on the CVV will be a great, you know, a good change for them, I want to say. And I want to thank you for allowing me again to be here. And thank you.
Any questions? Okay.
Ask you about the beans and the peanut butter. So don't get comfortable yet.
Yeah, please use the microphone that's right behind you.
So when you said they want more beans because they don't want the peanut butter, currently they can get beans instead of peanut butter. So can you tell me more about the beans that they want?
Yeah, they can request either or.
Right.
Okay, so we've seen an increase on the request for beans because they can't use the peanut butter because it's so much peanut butter. So if you get a jar every 3 months with the allergies, and then some of the schools don't allow peanut butter anymore, and again, the use of it. Also, I wanted to mention a little bit about the cultural side of it. Yesterday with the panel, that really touched because it is true. In a lot of cultures, peanut butter is not popular. I'm Hispanic, and peanut butter is not something that, you know, that we grow with. Mm-hmm. So when they come here, they need to basically learn about it or change, you know, like, oh, okay, you know. So that is one of the main points. So they've been requesting more beans, like the dried beans in our case, and they just learned to cook them.
Thank you.
Does that answer your question?
Yes. Okay. Our last speaker this morning is Deborah Lee from the Planned Parenthood WIC.
Hello, good morning.
I love it when my counterparts speak. I'm coming from that. Thank you again for allowing me to come and speak this morning. I'm coming from an aspect of also what we've seen among our participants. Planned Parenthood has several sites throughout Orange County, and we provide over 15,000 packages, over 15,000 families each month. So we would like for the committee to consider more flexibility in the packages. With the CVV, it's been shown that they love the choice of going to pick what they want, what fruits and vegetables that they want. Along with the nutrition education that we provide every single day, we're providing all these wonderful ideas and all these food prep meals and all these things, but they need the flexibility in order to do that. They need the flexibility to provide, to go and get broccoli and canned as well as fresh fruits and vegetables. So the up to values, I think, would be a wonderful thing for our packages. And also you've heard about the milk. We've heard it hundreds and hundreds of times. They don't like the 1% milk. They are using their own money to purchase milk and their SNAP benefits and things like that. So, and also the smaller yogurt packages. It's convenient. The 32 ounce is nice, but it's very convenient when you have a mom with several children to grab an individual yogurt, in order to feed her child in the lobby. We've seen them using them in the lobbies. We know we're not providing them, but we've seen them being used, to feed the children because it's convenient. It's easy to toss in their bag and feed their children on the go. As well as the fresh baby food, the meats. They're not being used. They come back. They're in the folders. A lot of the participants have also told us that, they don't like the texture. The babies don't like the taste. So in addition to those things, I would like to also have the committee consider allowing the fresh chicken, fish, or turkey. Fresh meats from the deli, either the deli or canned or fresh instead of the baby jars, to allow that for children. Children are eating meats, a complete meal. A lot of families consist of a fresh meat. So why not? We have a lot of choices. Why not give them the choice of buying canned meat or fresh meats for their children? Thank you so much.
Any questions? Are there other presenters who have registered who are not on my list? Okay. Well, that is the end of our public comment session for this morning. We thank everyone who came and shared their perspectives, and this meeting is now adjourned.